If you're not using AI on a daily basis, your competition probably is. Groups that adopt AI thoughtfully will outpace those who don't, faster than most people realize. That's the bottom line. AI isn't some futuristic buzzword anymore. It's here, it's already changing how practices operate, and it's moving fast. Medical groups that learn how to integrate AI into their daily routines, clinically, operationally, administratively, and financially, will be more efficient, more scalable, and frankly, more competitive than those who wait and see. Welcome to Medical Money Matters, the podcast where you can find experts, answers, and resources so that you can achieve mastery over the financial and business aspects of your practice. Hello, everyone. I'm your host, Jill Arena. I began my career in accounting and finance, and I have more than 30 years of experience running medical groups. I own and operate a national healthcare consulting and revenue cycle company, and I am the author of Physician Heal Thy Financial Self. In 2020, I co-founded the Physician Leadership Project, and in 2025, I released Physician's Edge, the first of its kind CME-accredited online business education for physicians. My passion is to increase financial and business literacy for physicians. Episode 160. If you're not using AI on a daily basis, your competition probably is. Groups that adopt AI thoughtfully will outpace those who don't, faster than most people realize. That's the bottom line. AI isn't some futuristic buzzword anymore. It's here, it's already changing how practices operate, and it's moving fast. Medical groups that learn how to integrate AI into their daily routines, clinically, operationally, administratively, and financially, will be more efficient, more scalable, and frankly, more competitive than those who wait and see. If you're picturing robots walking around the office, let me stop you right there. We're not talking about futuristic sci-fi. We're talking about tools that write your notes for you, draft your emails, analyze your claim denials, and help you prepare for board meetings, all in a fraction of the time it used to take. Today, we're going to talk about practical, daily AI use for physicians and healthcare administrators. We're going to break it down into 4 key categories, areas where AI is already making a huge difference in real practices, and where it can start helping yours right away. We'll also touch briefly on the importance of proper use. Yes, HIPAA still matters, but we're saving the full deep dive on privacy and legalities for a future episode. Let's start with what's probably the hottest topic in AI for physicians right now: clinical documentation. If you're a physician or a clinician, you already know the pain point: documentation, inboxes, charting. It's the thing that often keeps you working late, logging in after dinner, trying to catch up before the next day begins. On average, clinicians spend between 1 and 2 hours a day on charting outside of patient visits, according to data from the AMA. AI is changing that, and fast. There are now tools that use ambient listening to record your patient visits with consent, transcribe the conversation, and generate a structured clinical note for your review and signature. Tools like Nuance DAX, DeepScribe, and Augmetics are already being used in primary care, specialty practices, and large health systems. We're talking about having your note drafted before you even walk out of the room. Then there are AI assistants that generate documentation templates based on brief prompts. For example, you could type or say, 50-year-old with uncontrolled type 2 diabetes here for follow-up. And the system can create a full note skeleton, including HPI, assessment, plan, and follow-up reminders, all ready for you to edit and then finalize. Some AI tools are also embedded into the EHR inbox, helping draft responses to patient messages, refill requests, and prior auths. Think of it as a first draft that saves you from starting with a blank screen. None of this replaces your judgment. You're still the physician, but it gives you a huge head start, and that saves time, reduces fatigue, and gives you more time for what really matters. A quick note: If you're using AI in clinical documentation, please make sure it's a platform that's built for healthcare and that it's HIPAA compliant. Don't just start recording visits with your phone and uploading transcripts into ChatGPT. There are purpose-built tools for this, and they're worth the investment. And as we've said in previous episodes, AI documentation tools cannot read your mind, so you need to speak out loud or add in later those things you've considered for your patient, not just the things you did, so that you maximize your coding for complexity. Now let's talk about AI for administrative and operational tasks, something practice managers, COOs, and executives can benefit from almost immediately. Back office work eats up time, whether it's drafting job descriptions, writing HR memos, preparing internal SOPs, or even composing patient-facing documents. It all takes time, and it's usually time taken from higher priority work. AI changes that. You can use AI to draft clean, professional policies from scratch using just a few bullet points. You can generate emails that are clear, consistent, and polished. You can write a patient communication about a new scheduling policy in 2 minutes instead of 30. Need a social media caption about flu shot reminders? Done. Need a template for onboarding new front desk staff? Done. AI gives you a smart starting point, and you simply need to edit and personalize. Don't get too complacent, though. AI still needs you to review. It does hallucinate from time to time, so don't get caught by that. Some practices are also using AI to suggest scheduling improvements based on volume patterns and availability. Others are using it to analyze patient feedback surveys, extracting key themes from free text responses to identify areas for improvement. There are even AI email triage tools that summarize and prioritize messages so that your admin inbox doesn't become a black hole. This kind of support is invaluable in busy practices, especially when you're juggling competing priorities. AI doesn't take away your judgment, it just amplifies your efficiency. Let's move into the financial side of things, AI for coding, billing, and revenue cycle optimization. You're listening to Medical Money Matters, a weekly podcast brought to you by Healthy Practices, a healthcare consulting and revenue cycle company dedicated to keeping our clients independent. Please reach out if we can do anything at all to support your practice. You can find more information online at healtheps.com. That's www.healtheps.com. Please follow or subscribe to get all future episodes downloaded as soon as they're released. This is one of the most promising areas for AI adoption, and the tools are already getting really good. At the simplest level, AI can help improve coding accuracy. There are tools that read documentation and suggest CPT and ICD-10 codes, helping coders and physicians catch missed billing opportunities and reduce the risk of undercoding or denials. Think of it as a digital second set of eyes. And again, be sure the AI isn't suggesting you downcode unless you actually didn't do the work. In most cases, you did, so test your new AI coding software thoroughly to make sure it's advocating for you appropriately. AI can also analyze your claim denial data to spot patterns. It can tell you if a particular payer is denying a specific code combination more often, or if a particular modifier is triggering problems. And it can do that in seconds. Some more advanced tools even simulate payer contracts, allowing you to forecast how changes in CPT mix or volume will impact your collections under current and proposed reimbursement models. If you're not ready for full-on platforms, even general AI tools like ChatGPT can be helpful. You can ask it to draft a prior auth appeal letter or summarize the key points of a dense payer policy document. Again, just be careful not to include PHI in those queries unless you're using a secure version of the tool. The point is, AI can help reduce revenue leakage, improve cash flow, and make your revenue cycle team more efficient. Coders don't get replaced, they get supercharged. Let's talk about leadership next. AI can be a secret weapon for physician leaders, executives, and strategic planners. Whether you're preparing for a board meeting, writing a strategic plan, or modeling a new initiative, AI can be your co-pilot. Say you're considering opening a new location. You can ask AI to help you outline a feasibility plan, generate a pros and cons list, or even identify data points you should be reviewing before making a final decision. You can feed in meeting notes and ask AI to summarize key themes, action items, and next steps. You can draft memos, presentations, and talking points more efficiently, and spend your time refining the message, not wrestling with the first draft. AI also helps you pressure test your thinking. Want to know what a payer is likely to say about a proposed new contract term? Want to anticipate how a staffing change will affect patient flow? AI could simulate these scenarios and give you questions to consider, so you walk into meetings far better prepared. In a world where strategic clarity and speed matter more than ever, leaders who use AI won't just work faster, they will lead smarter. Let's pause here for a moment and zoom out. The groups that adopt AI early, thoughtfully, and strategically will outpace those that don't. Just like practices that moved early on EHRs or telehealth gained an edge, AI is now the next evolution. We're not saying it replaces human expertise. Far from it. AI is a tool, not a decision maker. But it's a tool that, when used well, can dramatically improve how you work. Here's the simple truth. Practices using AI will document faster, communicate more clearly, manage their revenue cycle more tightly, and make more informed decisions. Their physicians will be less burned out. Their administrators will be less overworked. Their leadership teams will be more focused. And most importantly, they'll have more time to lead, connect, think, and grow. So the real question isn't, should we be using AI? The real question is, where should we start? We do need to say just a few words about HIPAA and compliance. Not every AI tool is HIPAA safe. If you're using public-facing models, like the free version of ChatGPT, you should never include patient identifiers or protected health information. It's not built for that. Instead, use enterprise-level tools with proper safeguards. Make sure any AI tool you're using for clinical or financial work offers a business associate agreement, and that your staff is trained on what's appropriate to input. We'll go deeper into AI compliance and risk management in a future episode. For now, just remember, be smart, not scared. Use tools wisely, and when in doubt, ask. So, where do we go from here? Let's recap the 4 categories of AI use we covered today. Number 1, clinical documentation, ambient listening, smart note generation, and inbox triage. Number 2, administrative and operational support, including drafting policies, patient messaging, and scheduling optimization. Number 3, revenue optimization, AI-assisted coding, denial pattern analysis, and payer modeling. Number 4, leadership support, including strategic planning, decision modeling, and communication tools. Each of these can save time, reduce cognitive load, and improve performance. And even implementing one tool in one area can make a big difference. If you're listening to this and thinking, I don't know where to start, you're not alone. That's why we're here. At Healthy Practices, we're helping clients explore AI strategy thoughtfully, where it fits, what's worth adopting, and how to implement it without overwhelming your team. And as always, our first meetings are complimentary. If you're curious about how AI could streamline your workflow, help you save time, or support your team, reach out. We're happy to talk through options and help you chart a course forward. The future of medical practice is going to include AI. That's not a question. The only question is whether your group is going to lead, follow, or get left behind. Use it wisely, use it ethically, but most importantly, start using it. Until next time. Thanks for tuning in to today's episode of the Medical Money Matters podcast. Before you go, let me ask you, are you ready to take your medical group's coding to the next level? Because that's where Code Mastery comes in. Code Mastery isn't just another coding program. It's the ultimate physician-to-physician training solution to maximize your revenue, and empower your physicians with the skills they need to code confidently and win the coding game. From comprehensive high-octane training to actionable insights, Code Mastery gives you the edge you've been looking for. Don't leave money on the table. Visit healtheps.com/code mastery to learn more and take control of your coding today. Let's transform your practice's financial future starting now. See you next time on the Medical Money Matters podcast.